Hello, welcome to part 44 of Clinical Physiotherapy MCQ series. Here we gon discuss day-to-day clinical scenario with detailed explanation. Now don't waste our time, let's move to question number 216. A patient recovering from a stroke is being evaluated by a physical therapist. The patient is able to voluntarily elevate his arm through the synergy pattern without difficulty, but is unable to move out of the synergy pattern. Spasticity is still present. Which of the following Brunstrom stages best describes this pattern? Option A stage 1, option B stage 2, option C stage 3, option D stage 4, and the answer is option D stage 4. Explanation for this question is, the scale continues to stage 6 where no spasticity occurs and normal movement is re-established. Option A stage 1 is characterized by flaccidity and no voluntary movement on the affected side. Option B stage 2 is characterized by the development of spasticity and obligatory synergies that occur from the result of external stimuli. Option C stage 3 is characterized by continued spasticity and limited voluntary movement through the synergy pattern. Now let's move question number 217. A patient with cystic fibrosis is receiving postural drainage and percussion for the right lung's middle lobe. What is the most appropriate patient position? Option A supine on a wedge with the left shoulder elevated on pillows with the head lower than the pelvis. Option B supine on a wedge with the right shoulder elevated on pillows with the head lower than the pelvis. Option C prone with the right shoulder elevated on pillows and the head on the same plane as the pelvis. Option D prone with the left shoulder elevated on pillows and the head on the same plane as the pelvis. And the answer is option B supine on a wedge with the right shoulder elevated on pillows with the head lower than the pelvis. Explanation for this question is, option B is the correct position and is most appropriate for the right middle lobe, while option A is the drainage position for the left lingular lobe. And option C, this is the drainage position for the right posterior lower lobe. Option D, this is the drainage position for the left posterior lower lobe. Now let's move question number 218. A physical therapist is interviewing a female patient who reports mid-thoracic pain that is limiting her ability to work. Which of the following additional symptoms should prompt the therapist to refer the patient to a physician? Option A increased pain with prolonged computer work. Option B nausea, excessive fatigue, and sleep disturbance. Option C intermittent numbness and tingling in the right hand. Option D decreased pain with exercise and increased pain in the mid-morning. And the answer is option B nausea, excessive fatigue, and sleep disturbance. Explanation for this question is, mid-thoracic pain may be a pattern of cardiac ischemia, especially in women. Additional symptoms would include fatigue, nausea, shortness of breath, and sleep changes. Pain not induced by activity or static sitting posture would suggest a possible cardiac source. Now let's move to question number 219. You are a home therapist treating a patient who underwent a total hip replacement 4 weeks ago. You notice that the patient arches his lumbar spine in supine. He states that it is uncomfortable and doesn't remember having the problem before. The patient is unable to maintain a comfortable supine position due to option A poor abdominal strength, option B tight hamstrings muscles, option C tight iliopsoas muscle, option D tight piriformis muscle. And the answer is option C tight iliopsoas muscle. Explanation for this question is, tight iliopsoas muscles are common after THR surgery because the patient typically spends more time in a sitting position. The iliopsoas attaches to the transverse processes of the lumbar spine and the lesser trochanter of the femur. Therefore, when the iliopsoas is tight, the lumbar spine will extend if the femur is fixed. In supine, the hamstrings and piriformis muscles are on slack and would not cause alteration in spinal position. Now let's move to question number 220. A patient has right leg pain and displays redness and swelling throughout the foot and ankle distal to the knee that has developed over the last 3 days. The patient reports no trauma and complains of a deep ache in the calf musculature. What is the most appropriate initial treatment? Option A, refer to physician to further examination. Option B, elevate the lower extremity and apply an ice modality. Option C, instruct the patient on range of motion exercises and begin a home exercise program. Option D, perform instrument-assisted manual soft tissue mobilization to decrease the swelling. And the answer is Option A, refer to physician to further examination. Explanation for this question is, symptoms of a DVT include redness and swelling combined with a deep ache. Suspected DVTs should be ruled out before beginning treatment. Option B, while this may help alleviate some of the symptoms, applying an ice pack in elevation is not the most appropriate initial treatment. Option C, again, this may help with swelling, but is not the most appropriate treatment. Option D, this could dislodge the DVT which could travel and create a pulmonary embolism. This is contraindicated until diagnostic ultrasound can rule out any DVTs. So, that's all for today. If you have any doubts, please comment below. I think you have learned something valuable today. See you on the next part, that's part 45. See you till then, bye bye.